Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor, and this is a video about treating chronic viral infections. So this would include microbes, or viruses rather, such as Epstein-Barr virus, HHV-6 virus, coxsackie virus, possibly HSV virus, VZV virus. So, and this would be in the context of chronic viral issues that are contributing to systemic symptoms like fatigue or inflammatory symptoms in different parts of the body, possibly pain, maybe brain fog or other cognitive issues, different neurological symptoms, things like that. And so when it comes to viruses, they can certainly coexist with borreliosis or co-infections. They also will sometimes, clinically at least, and there's some scientific evidence to support sort of a correlation between issues with mold illness, so mycotoxin issues, maybe allowing for viruses to be more prevalent or active or become expressed in those patients' bodies, to my understanding largely because of some of the immunosuppressive qualities of the mycotoxins from the mold. And so in my experience, sometimes we need to work with certain antivirals to help get the patient to the next level of health, or to get things resolved all the way, get them over a plateau, whatever the scenario might be. And to be perfectly frank, a lot of these patients, if they're already dealing with a treatment protocol that's going after Borrelia or Bartonella or another co-infection, is a lot of the herbs that they're on already have some antiviral properties. So for example, if I'm treating someone with known or suspected Bartonellosis, I might use the word, herb rather, Isatis, which has some, clinically at least, some anti-Bartonella effects, but it also has some demonstrated antiviral effects. Or if I was treating a patient who was dealing with, say, known or suspected neuroborreliosis, then I might be already using an herb like, wanted to say worm for some reason. I might already be using, maybe I'm thinking of wormwood, I'm not sure. And I might already be using an herb like, say, Chinese skullcap, for example, which to my understanding has more of an impact on the central nervous system, but also, to my understanding, has quite a significant antiviral property to it. So in a lot of cases, when I'm, one of the many reasons I like using herbs to treat these types of to treat chronic infection issues is because they do have this multifactorial effect in the body, and so they're maybe I'm already going to be covering some of those antiviral bases when I'm using these anti-Borrelia, Bartonella, Babesia, etc. herbs. The cases where maybe I'm not already doing that would be patients who might be suffering from issues related to, say, methylation cycle defects, or heavy metal accumulation, or maybe mold illness, where we're not working with these systemic antimicrobials to begin with. So in those cases, if lab testing supports the idea that maybe there is some type of a viral issue going on, then that would be a good inspiration to go on some antivirals. Or sometimes it's just something that we're thinking might be happening clinically. Sometimes there's little clues that can come up in a patient's clinical picture, and if logistically or financially they're not able to do the testing that we might want to do to look for some of those viruses, then sometimes we'll go based on, or I will go based on, clinical clues to say, well, maybe we should be going after viruses. So if there's persisting fatigue that's just not, other symptoms are getting better from, say, the mold illness, but the fatigue's just like really taken forever to get better, or it's hit a plateau, or if the patient has chronic or recurring cervical swollen lymph nodes, or their tonsils seem to get irritated or something like that, that might be a clue that there's a viral component going on, and maybe we should be working with some herbs. Also, a correlation that I had only heard about from a colleague maybe 2 or 3 years ago now, that once I heard it, it's like, oh, wow, I've seen that a bunch of times, is sort of ulcers in or around the mouth, kind of like canker sores, basically, coming up just cyclically for no particular rhyme or reason, or only when they're feeling the most tired or stressed or something like that. And they said, oh, that seems to be a viral thing, and lo and behold, that seemed to correlate in my clinical practice too, which was interesting and always exciting to get a new clinical tidbit, I guess, in my experience at least. So those might be times to say that I might think to myself, well, maybe where you're not on herbs to go after other microbes, in a scenario like mold illness or something like that, then I would then maybe consider putting them on an antiviral herbal combo. So the herbs that I like to work with are discussed in great detail in Stephen Buhner's book, Herbal Antivirals. That's kind of one of my go-to resources. There are some other herbs that aren't mentioned in there that I certainly will use, like lamatium, for example, or angiographis seems to be quite a good antiviral, which I don't think he talks about in that book. He certainly talks about it in his Healing Lyme book because it's part of his core protocol. But then some of the other herbs like the Chinese skullcap that I mentioned, isatis, like I mentioned. Sometimes we'll use or semi-regularly use bone set as well. So those are things that I find to be helpful tools. So, of course, as always, work with your clinician to determine if those are therapies that are useful for you. And of course, you need to know like how much to take and when to take it, and when is it a bad idea to take it, and all of that, which is why clinicians like us exist. Those are some of the treatment approaches that I like to use when it comes to dealing with viruses. There are other things you can use too, like vitamin A, for example, or colostrum, or potentially vitamin C, or quercetin, or different things like that. But I find the herbs seem to cover most of the bases for me in my practice.